Greetings, everyone. I am Daniel, and this is my 12-month progress report. My thesis title is Novel Approaches in Optimizing Bone Health. I am a first-year PhD student here at CTM and a fourth-year orthotrauma resident at Semmelweis Department of Traumatology. My supervisors are Peter and Zoltan, and my SME and SMS are Marie and Amir. They all have been continuous help, and I wouldn't have made it this far without them. My vision is to have effective healthcare practices for maintaining optimal bone health and patient recovery. And my mission is to identify the most effective practices and protocols to achieve my vision. We have 3 ongoing projects currently. We are mainly focusing on the first one, which involves physical training in post-fracture patients. The second project has the same population and looks at nutritional supplementation. And the third one would be building on the first 2 and would be a randomized clinical trial protocol. My first project title is Investigating the Safety and Efficacy of Physical Training in Post-Fracture Patients. Why is this topic relevant? Why should you care? Well, there is a large population affected by musculoskeletal diseases, and fractures specifically still have to this day severe consequences even despite our best efforts, including death. Most of the patients never return to pre-fracture function. So seeing these facts, it is obvious that we need improvement in this field. And why training? Well, it is increasingly common knowledge that physical training and exercise are a magic bullet, basically. They affect health positively in many various ways. We have a population in post-fracture patients who are struck by immobilization, and immobilization can lead to severe bone mass loss and muscle strength loss already in the first few days. So we would like to see how physical training and training interventions affect this population. We ask the question, does physical training cause change in clinical outcome markers in post-fracture patients? We approach this question with the PICO framework, with the population being post-fracture patients, the intervention being physical training, progressive resistant training, high interval training, balance, and so forth. And the comparator is a no physical training, meaning standard of care or mobilization, or just no care. And the outcomes are changes in clinical outcome markers. We hypothesize that physical training will positively affect the clinical outcomes in post-fracture patients, with the implication of improving the care for this population and ultimately decreasing mortality. This is our search key. We have 3 domains: fracture domain, training domain, and a publication type domain. We only included randomized controlled trials, and we have found around 3,000 potential articles in these major databases. After the Prisma selection, meaning duplicate removal, title abstract selection, full text selection, and also including reference and citation chaser, we have arrived at 195 full texts. We have undergone a difficult data extraction phase with multiple statistician consultation, but we have finished it. So now we are looking forward to have nice plots and to finish the project in the next upcoming months. The second project title is Investigating the Safety and Efficacy of Nutritional Supplementation in Post-Fracture Patients. Why is this topic important? Again, why should you care? Well, nutritional deficiencies and deficits are common and widespread. Looking at nursing home residents, we have 80%. And even looking at elderly in the European Union, protein deficiency is also quite high. Micronutrient deficits even higher in the population. So it is also common knowledge that the vitamin D deficiencies cause various severe health consequences, also affecting bone health. So we would like to look at nutritional supplementation and its effects on this population. We ask the question, does nutritional supplementation cause changes in bone-related markers and clinical outcomes in post-fracture patients? The population is the same, post-fracture patients, as the previous projects. The intervention is nutritional supplementation, vitamins and micronutrients specifically, and the comparator is no nutritional supplementation or basic standard of care. And our outcomes would be clinical and bone markers. We hypothesize that supplementation will positively affect bone markers and clinical markers in this population, with the implication of improving care, improving recovery, and decreasing mortality. We have a finalized search key with 3 domains, a fracture domain and a nutritional combination domain with vitamins and microelements, and a publication type domain. We will also only be looking at randomized controlled trials to improve our quality of the project and the publication. And we have found around 8,000 potential articles in these major databases. We are now finishing up the feasibility phase with this project and looking forward to moving on. I would also like to mention my third project, a clinical trial protocol in the works, and its title is Investigating the Safety and Efficacy of Nutritional and Exercise Interventions on Mortality in Hip Fracture Patients. We asked the question, does implementing a novel evidence-based protocol improve the mortality in hip fracture patients? Our population here is operative hip fracture patients specifically, and we have 3 intervention arms, a nutritional protocol, training protocol, and training and nutritional protocol. And a comparator would be standard of care, mobilization, basic care. And our primary outcome or main outcome would be mortality, but we would like to add many more. We hypothesize that implementing the training or nutritional protocol reduces mortality in these patients, and this would have the implication of improving patient care and reducing mortality in this fragile patient group. So to summarize, we have 3 ongoing projects. We're mainly focusing on the first one, and we plan to submit it this autumn, around November. For the second one, we aim to submit it this year. And for the third one, seeing the results from the first 2, we plan to design and submit next year. And I would like to end my presentation with a reminder from Aristotle that the purpose of knowledge is action, not knowledge. Thank you for your kind attention.